Namaste to everyone. I am Nagaraj Patil, presently working as the Deputy Secretary to Government in Transport Department, Secretariat Vidhan South. I was there in Hyderabad for preparation of IAS in 2003, around 2003. I got the problem of gastric. Since then, I have been suffering from gastric almost 17 years. We started the treatment like I met almost 50 doctors related to gastroenterologist. They were started with the treatment, gastric related treatment. First, they have taken a colonoscopy. 2 times, 3 times I have done a colonoscopy, endoscopy, then ultrasound, X-ray, brain related scan, all those things they have done. They come to the conclusion that it is not related to digestive system. They were telling that it is related to psychiatric related issue. One doctor rightly in 2003, if I rightly remember, he told that it is IBS related issue. Then I could not get a proper doctor to get this treatment. Then still I was young, and at that time I was young, I was able to cope up with this related treatment. And when I met Dr. Praveen Jacob sir, I was introduced to him by my Minister PS, DCM sir PS, Sri SS Brother. Dr. Praveen Jacob sir clearly told me that it is not related to psychiatric issue, it is related to SIBO, smaller intestinal bacterial overgrowth, and IBS related. Both are like sisters and brothers. What happens in SIBO? If any patient is suffering from SIBO, the bacterial overgrowth, there is a overgrowth of bacteria in the smaller intestine. The consequences of that is that in the smaller intestine, in the gut, especially in the gut, some happy hormone, it is called as serotonin. Serotonin, it is produced in the gut, it has to reach to brain. 90% of this serotonin hormone is produced in the gut, that will go to the brain, that will act as a happy hormone. In my case, when I am suffering from SIBO, that was producing in the gut, but it is excess accumulation of that hormone in the gut, it was not reaching to the brain. Brain was lacking with that hormone, then it was moving to the depression mode and anxiety. Excess accumulation of that hormone in the smaller intestine, it is leading to overactivation of that gut, over movement, like sometimes I was having with the diarrhea, sometimes I was feeling with a constipation. Praveen Jacob sir, Dr. Praveen Jacob sir is basically is a scientist. He clearly explained me, no sir, nothing, it is related to gut issue only. We have to properly treat that. Treat means nothing, we have to do a proper diet. As the Indians rightly sir explained, as we Indians, 80% of our diet consists of carbohydrates. 15% of our diet consists of fat, then almost 5% is protein. Sir given me diet protocol, but while giving me, he told me one right word. Once you take my protocol, you have to religiously follow. I stick to that word, religiously I followed the diet given by the Dr. Praveen Jacob sir, and I also talked to Sri Venkatramana sir, Dr. Venkatramana sir. Sir also given some medicines related to IBS, especially SIBO and IBS. These people have a good medicine. I am almost, before coming here, I was having a doubt because I met almost 50 of the best doctor, whether these people will cure my disease. I was having doubt before going to Nisargamani. I was thinking, why don't I take almost 10 days a year only, that whatever they told diet. I start practicing that diet given by the Dr. Praveen Jacob sir, but I always keeping in mind that religiously I have to follow, because once I have to come out of this, that 17 years old problem, I religiously and honestly I followed diet given by the Dr. Praveen Jacob sir and the medicines given by the Dr. Venkatramana sir. In the 10 days, almost 60 to 70% I got cured within 5 days. 5 to 6 days I was getting some happy. I was living with the present moment. I was started to play with my child. I was talking to my wife and family members. I started to call everybody. Then everybody surprised. Why? What happened? Sudden change in your life. Then I thought that this is related to gut issue only. I have to concentrate on gut. Then I decided to come here. After coming here, I got a good treatment. Treatment in a sense, good advice, like nothing treatment like no chemicals, no medicines. They are giving me good advice related to diet and medicines, like they have introduced one IBS Kasai. That is very nice for SIBO and IBS. And in one class, Praveen Jacob sir clearly explained how it causes problems to the whole body, the bacterial issues. Sir, after coming here, we discussed with sir. He has given enough time to me. I am very lucky and fortunate to have a good time with sir. Sir told that it is not irritable bowel syndrome, sir. It is irritable bacterial syndrome. I got convinced that it is a bacteria related problem it is causing me. And in one class, sir is told that good bacteria is like you are better off. Then she is my first wife, bacteria is my first wife, then I have to take care of my good bacteria in my gut. Sir, one topic he has taken, rightly he has, the topic heading was 50% human. What we human eat, 50% goes to our body, another 50% we have to concentrate on maintaining a good bacteria in our gut. That I am very fortunate that I got a good doctors, but though I got very late, still it is not late. Now I can almost 80 to 90% I got cured. I am very happy now. I am not taking any sleeping related tablets. Before coming here, almost 1 year, I have taken Rivotril, sleeping related tablets, settle in. Now I am completely away with all psychiatric related tablets and gastric related tablets. Strictly I am following the diet given by the Dr. Praveen Jacob sir, and medicines like IBS, all those things. Almost 80 to 90% I have got cured. Another 10% I have to follow that. It's a matter of 5 to 6 days I will get out of this. After that, strictly I will follow the Praveen Dr. Jacob sir diet. Sir,
thank you, sir. Wonderful and lovely testimony, and definitely I have a conviction that your words will motivate lakhs of sufferers, IBS sufferers across the globe, because I do know that the sufferings and the suffering brought by these tormenting ailments, many people feel to commit suicide because most of the doctors dictate that IBS is a brain issue, it is not a gut disorder. So that is the major mistake most of us will commit. But here, luckily, we started focusing on gut bacteria. They plays a very significant role from the brain hormone to immunity, which are controlled by bacteria in our gut. So if someone suffer from IBS, I will call it is not irritable bowel syndrome, it is irritated bacterial syndrome. So if you take care of your bacteria in the gut, definitely you will get 100% remission of your tormenting ailment. And my sincere advice, sir, kindly follow good diet for 1 more month, and whenever you consume any diet, always you should keep in the mind that you have a better half. You have billions of galaxies of bacteria located in your gut. So it is not only you should consume the food, always you should try to please your better half. And this
another thing I add to all the patients who are suffering from IBS, they cannot know that it is IBS. They only feel that some gastric related issue because they are not scientists. Like me, layman, we can only feel that there is a stomach bloating and there is a constipation, if it is a diarrhea. I honestly and sincerely request you people to consult Dr. Praveen Jacob sir and Dr. Venkatam sir, because the money is not the matter, unnecessarily time is also not the matter, unnecessarily you get suffering. That is no end. That will, as rightly sir one day discussing, it will not kill us, but daily it is killing us. That is very irritating. If I tell any people surrounding me, like my colleagues, my family members, my brothers, they were telling that everything is normal, all reports are coming normal. What problem with you? You are a psychiatric patient. Why you are not accepting that you are a psychiatric patient? One beauty of me and myself is that I have never accepted that I was a psychiatric patient. I was telling everybody that it is related to gut. I am very confident person. I never went into depression. It is not a depression. It is irritating my stomach. That will radiating to all parts of the body. I never accepted that it is a psychiatric related. I request all the people who are suffering from gastric, you also never accept it is a psychiatric related issue. Please clearly understand it is related to the gut issue. Please clearly take the proper diagnosis. You get it properly diagnosed and take a proper treatment, also very important. Why I am telling proper treatment is important? My IBS related issue I got in 2003 only, but nobody was able to treat that is a IBS related issue. Here nothing treatment, they are not giving treatment, they are awakening us to the proper diet. That is very important. They are not giving any treatment, they are advising and they are educating us. That is very helpful for gastric persons, especially those who are suffering from SIBO and IBS. I honestly request all the people who are suffering from gastric, because you as a layman you cannot know that it is a SIBO or IBS. Better if you are suffering from a gastric for a long time, like 5 to 6 years, 3 years, 4 years, better you consult the Dr. Venkatam sir and Dr. Praveen Jacob sir, because he is a scientist. He will help you a lot without putting you many chemical medicine into your body. You will feel happy and your body will feel body will start to cooperate with your mind and the surrounding family members. Now they are all my brothers and my wife and my children are convinced that my father is very good and my husband is good, my brother is good. He is not with a psychiatric patient, he is with a gut related issue. Now I have got a confidence that I trusted myself more than anybody, doctors and anymore. Now I feel that I am very lucky and very happy to be here for 10 days. I continually keep in touch with Praveen sir because he has given me a second life, I think, as well as Dr. Venkatam sir. These 10 days, like 17 days, it is a transformation of my life. Depression, anxiety to a good life, happy life. Because as I told earlier, as a deputy secretary, I was getting all materialistic things. Anything I want, it was getting to me. But without happiness, I was not able to enjoy that moment. Now I feel that I am very fortunate to have these people in my life. And I request Praveen Jacob sir, treat all the patients who are suffering from IBS the way you have treated to me. That is a sincere request. That will give more life to many people and many family, and they will do some service to the society. This is my honest request, and thank you very much, sir.
Thank you,
Dr.
sir. Thank you
Dr. sir
for
and
your
Praveen.
honesty. Thank you,
Thank you, sir.
for
Thank you
your
very much, sir.
motivational words. Really, your words will transform the lives of millions of Indians.
Thank you very much, sir. Thank you, sir.